Are you feeling burning, stabbing, grinding, or shooting pain when you turn over in bed or get out of the car? That's what I felt when I had pubic symphysis disorder, but I want to know what you are feeling, so comment down below. But you're in the right spot because in this video, I'm going to be going over 6 exercises for you to overcome this pesky but common pregnancy discomfort. Hey fearless mamas, so pregnancy can lead to altered pelvic load, lax ligaments, and weakened muscles. This often leads to pubic joint instability, which can often manifest itself into symphysis pubic dysfunction. So what we can do is strengthen and release those surrounding muscles for better pelvic balance and alignment. I had help hand-picking these exercises with my good friend Olivia Cagle, who is a prenatal corrective exercise specialist. These 6 exercises can do wonders, but they are best paired with a Webster certified chiropractor who knows about symphysis pubis correction. But with that being said, let's get started demonstrating. Number 1, the kneeling squat. Begin on your knees with your knees about shoulder width apart. Engage your core, inhale and sink back towards your heels. Exhale and squeeze your glutes to rise back up and hold that spot for 3 seconds. Slow and controlled, lower back down to repeat 20 times. Number 2, the basic bird dog. With your hand directly underneath your shoulders and your knees under your hips, tighten your core to keep your back flat and relax your shoulders down. Raise your right arm in front of you and extend your left leg behind you. Hold for 5 seconds while keeping your head and spine in a neutral position, and make sure to keep your pelvis parallel to the floor. Lower back down and alternate legs 20 times. Number 3, the pillow squeeze. Begin sitting with your ribs over your hips and your knees over your ankles. Inhale and place a pillow loose in between your thighs. Exhale and squeeze the pillow for 3 seconds. Then relax without letting the pillow fall and repeat 20 times. Number 4, bent knee toe taps. Lie on your back, face up with your knees and hips bent 90 degrees. Place a pillow under your low back to add additional balance and stability for the lower abs. Point your toes and press your lower back into the pillow as you exhale. Brace your abs in tight as you tap one toe downward to the ground in alternating legs 20 repetitions in a row. Number 5, bent knee fallout. Begin on your back with your feet flat on the ground. Engage your core by hugging your baby and lift your pelvic floor. Place your hands on your pelvis to help you feel for movement. Slow and controlled, lower one knee down toward the ground without allowing movement in your pelvis. Then lift back up and alternate legs for 20 repetitions. Last, number 6, the inner thigh lift. Lie on your left side, propping yourself on your left elbow and forearms. Cross the right leg over the left, placing the right foot on the floor next to your left knee. With your foot flexed, lift your left leg slowly and hold for 2 seconds, then slowly lower your leg to the floor. Repeat 20 times and then switch to the other side for another 20. Before I go, something more important than these strengthening exercises is body balance. Learning how to breathe correctly and strengthening your inner core muscles with diaphragmatic breathing and belly pumps actually helps your body carry the demand of extra pregnancy weight as a way to prevent body aches and pains. One more thing before I go. The large and powerful psoas muscle runs down the lower mid-spine, goes across the pelvis and curves over the pubic bone to attach on the inside of the top of the leg. So if you have seen any of my previous videos, I talk about how there are lots of ligaments and muscles that can become twisted and torqued in pregnancy. And if you know the nature of my videos, I go into how that affects your birth and labor and the way you feel in pregnancy. So I highly recommend doing a daily pregnancy stretching routine. My specific AM and PM videos have several stretches to release specific muscles that are connected to low back pain, hip pain, groin pain, etc. all the pains that can be common in pregnancy. My two favorite as it pertains to pubic symphysis dysfunction would be the psoas release and the hip slide and glide. Those are great ones to kind of keep maintenance and balance those inner pelvic ligaments. Well, in my next video, we're going to go over how to prevent pubic symphysis dysfunction, like properly getting out of the bed or out of the car when you are pregnant. Little disclaimer, talk to your healthcare provider before beginning any exercise routine. Thanks, and see you in the next video.